Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Atypical benzodiazepines. Atypical benzodiazepines are zolpidem, zolpiclone, and zolpidem. So these are atypical non-benzodiazepines. These are atypical non-benzodiazepines. These will bind to the GABA A receptor, which contains the only alpha subunit, and they will enhance the membrane hyperpolarization. They all mainly decrease the latency of the sleep. They decrease the latency of the sleep. And there are two drugs. Zolpidem. This zolpidem is the drug of choice for sleep induction. So zolpidem is the drug of choice for sleep induction. And escitalopram is the drug of choice for sleep maintenance. So if you have to give a long term treatment for sleep disorders, then it is better to start the patient with escitalopram. So zolpidem will decrease the zolpidem and escitalopram will decrease the latency of sleep onset, and it has little effect on total time of the sleep. So zolpidem will mainly decrease the latency of the sleep onset, and it has very less effect on the total time, whereas this escitalopram will increase the total sleep time. So because escitalopram increases the total sleep time, it is used in maintenance therapy. And zolpidem, because it decreases the latency of sleep onset, so that with the zolpidem the patient gets the sleep very easily. So as a result, zolpidem is used for the uh, induction of the sleep. Then we also have one more, which is zolpidem. Zolpidem decreases the random eye movement sleep, and it has less effect or minimal effect on slow wave sleep. There is no rebound sleep phenomenon seen in atypical non-benzodiazepines.
thank you and thank you for watching.